Good evening. A lot of news to cover tonight, but we are going to begin with this. Women who count on Planned Parenthood and other organizations for health services may have to look elsewhere. Planned Parenthood announced today it will give up the federal funding it gets for those services under a program called Title X, rather than comply with a new rule from the Trump administration. Planned Parenthood says the more than 1.5 million women they serve could be affected. The rule, pushed by religious conservatives, prohibits clinics from referring women for abortions. Chief legal correspondent Jan Crawford leads off our reporting tonight.
Calling the new Trump administration rule unethical and dangerous, Planned Parenthood said it had no choice but to withdraw from the federal program and turn down some $60 million a year because it is unwilling to counsel patients if it could not refer them for abortions. The Title X program distributes some $260 million in grants every year to clinics, subsidizing birth control and family planning services for some 4 million women nationwide. By law, the federal money could never be used to perform abortions. But under the new rule, clinics that get money under the program no longer can refer patients for abortions. The rule is almost identical to one issued by the Reagan administration and upheld in 1991 by the Supreme Court.
This attempt by the Trump administration to enforce the gag rule is another coordinated attack on reproductive health care.
Planned Parenthood acting president and CEO Alexis McGill Johnson.
The impact will mean that people may choose to forgo care. They may choose to delay their care until this is resolved, and that's what's unacceptable.
It's unclear how many women would be affected. Planned Parenthood says it has served about 40% of the Title X patients, and that some who would be eligible for free or discounted services under the program may have to seek care elsewhere. Jeannie Mancini, president of the March for Life, said Planned Parenthood was making a political choice.
This is less about women's health and advocating for women in need, and it's more about advocating for more abortion.
And Jan Crawford joins us tonight. So, Jan, what is Planned Parenthood and other clinics' next move?
Well, Planned Parenthood is going to continue to try to fight this in court. And in the meantime, they say they're going to continue to try to provide services to these low-income women without this funding. They said some states are going to pick up this shortfall. They can tap into some of their emergency funds, contingency funds, and also through fundraising. But nor they stress that is not a long-term solution.
All right, Jan Crawford, thank you.